Welcome back. Over 2 million children are to benefit from several medicines to help treat and prevent some neglected tropical diseases in Cross River State. Now, the state government says it's looking at completely eradicating NTDs in the state by the year 2020. The State Commissioner for Health, Dr. Inyang Asibong, who was speaking while monitoring the exercise at Ogoja local government, said 9 out of the 10 diseases highlighted for control are endemic in the state.
Cross River State in South Nigeria, like most tropical rainforest regions around the world, is prone to many diseases associated with unhygienic water supply for consumption, soil contamination, amongst others. The state government says the state, through its partners, is poised towards making a difference in eliminating these diseases through rapid vaccination across the state.
Last year alone, we had distributed drugs to over 2 million people in Cross River State. This year, we are going to increase that number to more than 2 million because we want to make sure that almost the whole population is actually at risk of having NTDs. So we want to make sure that everybody at risk of NTDs actually has the prevention, because we know that prevention is always better than cure.
Beyond vaccination, people have also been encouraged to take personal responsibility through the use of simple precautions like sleeping under mosquito nets, engaging community members to administer medicines in their communities, amongst other measures.
Infection, and it will be preventable if the individual takes 1 tablet of Mectizan on an annual basis. For the lymphatic filariasis, surprisingly, a lot of people do not seem to recognize that lymphatic filariasis, otherwise called elephantiasis, is caused by the same mosquito that causes malaria. So sleeping under the bed net is a very important and preventive strategy. More importantly, to dispose of human waste and urine very effectively so that this transmission cycle is broken from where it is reinfecting the entire population.
This move by USAID to ensure that these diseases are eliminated by way of promptly administering medicine for prevention is a good start for us.
As Cross River State and the world at large looks forward to rallying together to chart a new course towards a world free of NTDs, citizens have also been urged to take the necessary steps towards preventing disease.
We're in Kwara State now, and Governor Abdul Fattah Ahmed has called on financial institutions to develop products that are in consonance with the dynamics of businesses in the country. According to the governor, developing better products, responses, flexible access, and de-risking businesses will improve financial services through inclusion. Governor Ahmed was speaking during a meeting with a financial inclusion strategy team from the Central Bank of Nigeria, led by its controller in Kwara State.
Financial institutions will be required to develop products that are in consonance with the dynamics of a lot of businesses, so that it allows for some level of flexibility where areas have been properly de-risked to get them included in financial intermediation. It is very critical. I know that there are thresholds below which they cannot go in terms of who they lend to. But of course, we have the microfinance banks. The microfinance banks are required to be strengthened on how to improve on compliances and, most importantly, to broaden their scope of playing a critical role in financial intermediation at the grassroots levels. Most of them are largely located in urban environments, and they are not able to truly play that critical role of intermediating financially for people at the rural environments. So I think in the regulatory responsibilities, we'll begin to see how they are not only located but also mirror commercial banks in terms of compliances and in terms of ensuring that people are properly captured in the database.
And with that, we draw the curtain on this edition of the program. Thank you so much for joining us. I'm NTD Balu.